Okay. Hello, hello, hello. It's Saturday, last Saturday in January. Hello, my name is Abby Tyler. For those of you who don't know me, my name is Abby Tyler. I am a family nurse practitioner coming with a 22 years of RN experience. Today, we're going to be discussing congestive heart failure. With everything else that's going on in the news and in our community, we just thought to bring this information to you guys. And of course, February is Women's Heart Health Month. So hopefully, we'll be bringing more information about cardiac issues to you guys. Today, with me, I work in a private setting. I used to be working in acute care setting before. Today, I have my friend and former coworker and somebody who is like well versed in congestive heart failure and other cardiac issues. My friend who is like big time person, but of course she'll be modest. Her name is Theresa Conejo. So I'm gonna allow her to say a little bit about herself and her credentials, and then we'll get right into the program. Hello, Teresa. Can you introduce yourself to the guests, the viewers?
Sure. Hi, Abby. Hi, everybody. My name's Theresa Conejo. I'm a registered nurse. I've been a nurse for 36 years. I have my fellowship with the American Heart Association, and I am a heart failure coordinator. I was a heart failure coordinator at Nazareth Hospital. I'm so happy to be here today with my friend Abby. She's doing a great job. She's so informative, and she brings thought-provoking issues on our health and helps us keep healthy and gives us the tools we need to keep healthy. So thank you so much for having me.
Okay.
So my experience with heart failure was a personal one.
Go ahead. Teresa, are you still
Experience
there?
with heart failure was a personal one. Dad had heart failure. He was at age 56 with an arrhythmia called atrial fibrillation. So he actually managed it quite well. He passed when he was 80, but he managed it by going to the doctors regularly and by taking the medication that was prescribed to him. And he did everything that he could. He could have managed a little more with exercise, but he did the best he could. And like I said, he passed when he was 80. So I got a firsthand view of what it was like to be a heart failure patient. So first of all, heart failure, when we hear the word failure, that's such a strong word. I wish they called it something else, because when you think of failure, you think of something that stopped, something that died, something that can't be brought back. Where heart failure is not that. Heart failure is caused by damage to the heart that makes it more difficult for the heart to pump the blood. Unlike a heart attack, people sometimes get heart failure and heart attack confused. A heart attack is when there's a artery that's blocked, an artery that's going to the heart. It's blocked for some reason, and it can't get blood and oxygen to that part of the heart. So that part of the heart dies off. Where heart failure, it's the pumping mechanism. It has nothing to do with the arteries. So, heart disease can cause heart failure, high blood pressure, coronary artery disease, heart attack, heart valve disease, irregular heartbeat, like an arrhythmia, like atrial fibrillation. And there's some other causes too that are found amongst people: sleep apnea, obesity, severe lung disease, diabetes, abnormal heart valve as a child, congenital heart valve defects, low red blood cell count, overactive thyroid, or heart muscle disease. All these are contributors to heart failure. So
Okay.
now, signs and symptoms, it can
I'm
vary
just
based on the type of heart failure a person has.
okay. All right, Teresa. Also, when we talk about the causes of heart failure, most of those causes, some of the causes that are on there are modifiable. So there are ways that we can prevent them or also control them that would prevent us from getting into heart failure. Right? I'm sorry. Go ahead.
Absolutely. The risk are the causes. So if we can control the risk factors, then the cause can be controlled.
Okay. So, can you tell us some of the signs and symptoms of heart failure?
Sure. So, signs and symptoms are based on the type of heart failure a person has. Factors such as is it right sided heart failure, left sided heart failure, the suddenness of the onset, the severity of the condition can all affect what symptoms a person may develop. In some cases, a person may have shortness of breath when exercising or engaging in some strenuous physical activity. As the condition gets worse, though, they may develop shortness of breath just doing their ordinary tasks like walking up steps or preparing their meals or lying down, even lying down flat. Sometimes people tend to put their head to breathe. So it's a progressive disease, and the other signs of heart failure would be general weakness or fatigue, a cough, especially a wet cough, bluish color tinge in the fingers or lips, abdominal pain, inability to sleep lying flat, loss of appetite, weight gain, or swelling. That's a big one, swelling in the ankles, in the abdomen, in the neck vein, or the feet. Now, these are like generalized signs and symptoms that could be pertinent to other conditions as well. So when we have somebody that presents to the ER, they come, they're short of breath, they have generalized weakness, they may have a cough. Well, we don't know. Is this heart failure? Pneumonia? Or did they have the flu? So we don't know. We have to get a better picture of this person. So the first thing we would do is do an assessment on what is your history? Do you have a cardiac history? Do you have a family history of heart disease in your family? Then we would ask them some more information. When did it start? What were some things that happened that preceded these signs and symptoms? Then what we would do is we would then do a chest X-ray. Okay, if they're symptomatic, we'll do a chest X-ray. We're going to look for some fluid around the lung. It's called pleural effusion. If someone had pneumonia, we would see something called infiltrates. But in heart failure, we're looking for pleural effusion, which indicates to us there's fluid overload. Then we will test their blood. We're going to be looking for a particular marker called a BNP. It's a lab test. And the elevation in BNP is usually a clue. It's not a telltale sign, but it's a clue that there perhaps is heart failure, congestive heart failure. And then we would follow up with an echocardiogram of the heart. And what we're going to look for is the ventricles. How are the ventricles functioning? Is there any leaky valves? And then we're looking for something called the ejection fraction. And this tells you how well your heart is pumping. The normal ejection fraction for someone without heart failure usually is around 50 to 60. And we'll see an ejection fraction of 40 or below with someone with heart failure.
Okay. Okay. So
So then
when
what
it,
we treat it with? Okay, so you're given that diagnosis, you're in heart failure.
okay. Can you are you there?
So the doctor said you're in heart failure. What's he going to do?
Mm-hmm.
First, he gives you a beta blocker. Yes, he'll give you a beta blocker to control your blood pressure. He'll give you maybe an ACE or an ARB, and that's a class of a drug that opens the blood vessels so the blood can flow through and help with the pumping mechanism. And then he'll probably give you a water pill, a diuretic, pills such as Lasix to take the excess of fluid, and that's going to help with the swelling and the breathing. Okay. Then this is where your part comes in, the patient. You're going to be put on a fluid restriction and a sodium restricted diet. And I think that's the hardest part is the diet restriction of sodium. For someone with heart failure, sodium intake 1200 milligrams a day or less. And that's really hard. I mean, it's a behavior modification. And we all know that any kind of behavior modification is difficult, whether it's stopping smoking, stop drinking, losing weight. It takes work. And, that's where the hard part comes in is modifying your diet. Then you need to read the labels. With my father having heart failure towards the end, I was doing a lot of the shopping for him and cooking for him. And I was like astounded when I looked at the back of some of the labels of the food in the food store. Seniors tend to like to eat frozen dinners. They pop them in the microwave. They're real easy to make and they're fulfilling. But when you look on the back of them, the sodium content is almost equal to the 1,200 a day that he was allotted. A can of soup. How many people eat soup for lunch, especially now in the winter? It's cold. We like to eat a can of soup or even homemade soup. And the sodium content is out the roof. I mean, everything that we have, anything canned or processed, has sodium in it. Even canned vegetables has sodium in it. So I think what we need to do is involve the family. Who's cooking the meals? Who's shopping for the patient? We need to get the family involved. When they say it takes a village to get something done, it's true. We do need the family members, we need the caregivers, we need everybody involved here to get on board.
You still there?
Not drink more exercise. I mean, we used to think that, no, don't let them exercise, but now we found through studies that the heart move, it needs oxygen. So whether it be a brisk walk, ride, gardening, bike ride with the kids, just move. Get the exercise. You need to monitor your daily weight on a scale. Keep the scale in the same spot in your kitchen or your bathroom. Don't move it around because you're going to get a different reading. So keep that scale in the same spot and do your daily weight. If you see you got a 5 pound weight gain overnight, it's not from eating a big meal. It's probably because you have fluid overload and you need to call your doctor. Stop smoking, limit your alcohol intake. These are all prevention things that will help your high blood pressure, but it will also help failure. Now, Abby, we talked about this today. We talked about a lot of our cultures. We have recipes that we handed down from generation to generation, and a lot of them are filled with a lot of seasoning and a lot of sodium. And there are ways to cook that same recipe and still have it tasting just the same. Do you
Yes.
want to weigh in on that?
Yes, of course. I was talking to you about that in our Liberian community. I can only speak for Liberian community as being African American. I can speak for like a certain aspect also, but African Americans as a whole also. We do a lot of seasoning. For us, we put in like the seasoning and then the seasoning, salt, and then there's something called we different little cubes that was additional seasoning. So from the way we cook our food and we cook it completely, and if you don't have all of that in there to make it taste good, we just automatically think that it doesn't have any taste. The food doesn't taste good. And we don't, well, now that we're realizing now that all of that is all salt. And for most of us who suffer from high blood pressure or have family members who have high blood pressure, so that makes us as risk factors too. So that's why I tell my people, I say, don't put too much salt in it. If you're going to put seasoning salt there, then don't put salt there. Don't put the extra bouillon cube in there and all that. All that just piles up into your body and keeps the fluid into your body, just makes your blood pressure higher. Eventually, that will also affect your kidneys too. So there are different methods of seasoning that can make the food taste good and also keep you healthy. So that's one of the main things that we're trying to push now. And also, I try to introduce more fruits and vegetables. Don't just eat the rice and the stew, but you want to make sure you add fruits and vegetables and everything that's going to add more fiber and roughage that's going to get all that gunky stuff out of your body and not sit there and turn into fat and cause other problems.
Yeah, fast foods are the biggest thing. We have a lot of people, particularly older people who are widowed, and they like to eat in the restaurants and diners. And we know the food in the restaurants full of sodium, but there are some menus in the restaurants and diners that have heart healthy food. So I do like to educate people to, try to look for the heart healthy stuff. Most likely it's going to be less in sodium, less in fat. And you could still be, it's still a meal and it's good tasty. And I think reading the food labels is the big thing, know what you're eating. Does that mean you're never going to eat a hot dog again? Does that mean you're never going to eat soup again in your life? It's similar to Weight Watchers. If you know you're going to go to a barbecue and they're going to have hot dogs and you really have nothing else to eat, have that hot dog. Don't have 3, 4 hot dogs, but have that hot dog and know that you got something sodium. And then for dinner, have something really light, like a salad, or the next day, eat light. So it's like modification, switching around. But moderation is what I tell people, because otherwise, if you deny yourself some of these foods, then you're just going to go crazy and then eat it, and it's okay. Sometimes we do fall off the fence, and you just have to pick yourself up, brush yourself off, and start over again. Like I said, behavior modification is tough.
Yes, and as certified nurses who work, we both work in CHF floor. As the nurses that worked on the floor, you're the coordinator. We had to, as the patient was in the hospital most of the time, about 2 to 3 days at a time. So it was important that every time that patient was in, that we had to give them the entire hour of education. We had to educate them on the medications they're taking, the kind of medications they're taking, why is it important to take it, not to miss any dose, not to skip any dose or decrease the amount you're supposed to be taking. Making sure that, like you talked about before, weighing yourself every day. I always tell people, get up in the morning, go to the bathroom, pee everything, and then weigh yourself every morning, same time every morning, and kind of record it. So, and you call your doctor if you find yourself gaining 5 pounds or more, most, saying 3 to 5 pounds or more over a couple of days. If you start getting shortness of breath and all that, making sure, because you're going to be getting involved, it's going to be your primary care provider and you taking care of that, and eventually, hopefully, it won't progress to the point where you're going to need a nephrologist, which is a kidney doctor, or whichever else that's playing along in the team. If you're like a bad diabetic, or a diabetic that's not, your numbers are not controlled, we're going to talk about that also, making sure your numbers are controlled. Anything else, if you have sleep apnea, you want to make sure, if they put you in any kind of breathing machine, when you're supposed to use it, when you go to bed, you want to make sure that you use it, because sometimes some patients are not compliant. They'd be like, I don't like that thing on my face. And then say, okay, then speak to another doctor, who should be the pulmonologist, because we're going to add other people into the group. It takes a whole disciplinary team, and say, okay, talk to them and see what your insurance covers. If they can give you something else to use that will help you breathe, because if you cannot breathe, like I always tell my patients, if you cannot breathe, nothing else matters. So while you're in the hospital, we take care of the acute care part. We're giving you your Lasix. We're making sure we're weighing you every day, watching how much you take, going over and over everything you're supposed to do, and documenting that, because the joint accreditation counts on that too, and that's mandated. And then when you do come home, that's when I come in and start taking care of, when they call me in the office, when they come to see me, I do my full examination, listening to the lungs, watching their feet, looking at feet to see if there's any kind of swelling, making sure all the medications that they were discharged on from the hospital, that they are taking those medications like the way they're supposed to be prescribed. They were prescribed, and go on from there to do everything to keep you healthy. Anything else you'd like to add, Miss Teresa?
Yeah. And you know what? You made a good point, Abby. You need to find a doctor or cardiologist that you feel comfortable. Yeah, I said, it's good. You made a good point. You need to find a good cardiologist or a doctor that you trust and you have a good rapport with, because you're going to be seeing them a lot, okay? And you're going to be calling them a lot and asking them for advice. So it has to be someone you feel comfortable discussing your healthcare matters with. That's really important. And I'm so happy, glad, Abby, that you mentor a lot of young African American girls, a lot of Liberian girls and men in the profession, bringing them into the nursing profession, into the medical field, because we need more diversity within our medical community. We really do. And it's so important. So I thank you in that respect, in all you do in bringing in nurses to the fold.
Yes, that's very important, because when you come in there and you see people who look like you, and not only just people who look like you, because like I always tell people, the patients that I work with now in my field, in my practice, don't look like me. So I don't want to say come in looking like me, and they may say they're not one me. So, but main thing is, we bring another perspective to the table. I could be talking. I had a Liberian patient where, remember one time we had a dietitian that came in and talked to her about lowering her fat, mashed potatoes and all that. And she said, I don't eat any of that, so I'm good. And I told her, I said, no, well, you're eating rice every day. So that's the same thing. So you may not be eating that, but you're eating rice every day, still carbohydrates, that's sugar and all of that too. So knowing the kind of food, the food that we eat, and being able to like and reach another population of people, high risk population of people, that's also important too. So, and different minority groups and also So that's very important. So, and also I thank you for all that you do for your community and also for community where we live in. So you do a lot
Yeah.
for every community. So all hands on deck to keep a healthier community. Okay. Let me see here. So, okay. So do you have any final
Yeah.
word?
Share. We have to share our resources with each
Yes.
other. It's
Yes,
important.
it's very important. That's why when people think, I tell people, I say, learning all of this and not being able to share your knowledge and bring back and go back and help your community, then what's the point of it? You want to be able to do that. That's why even when we did the health fair for Ben Salem, I'm always happy to be there and help everybody from other communities as well. So I like doing that, and as in addition to the health fair that I have at with the Liberian community as well. So it's all hands on deck and making sure everybody from every community is well taken care of.
Yes, indeed.
So,
Indeed. I
go go ahead.
Do we have any questions from the audience? They can put their questions in the chat if they like for Abby or myself.
I'm looking there so far, and I don't see
No
any
questions from the
comments or
audience?
questions. I didn't see anything. There's one person there, but I think that's just somebody who's just always post something that they're not supposed to post. But other than that, no, I don't see anything there. So sometimes people post questions after the broadcast. So
Okay.
just be available to answer those questions when they do post after the broadcast because a lot more people watch after than during. So, but any final questions? Any final passing closing statements from you?
No, just everyone stay healthy and happy and see your doctor regularly.
Yes, yes. And to close, I just want to say this is our first. I've been doing the StreamYard now for about 2 weeks, and this is my first time bringing somebody on. So if there's any technical thing in the background, I apologize for that. And hopefully, I can get Theresa back on because next month is Women's Heart Health Month, and she's a pro at that. So she was one of the publishers of the new guidelines. It's always good to have a nurse on board for that. So hopefully we'll be able to get her back on and give you guys more information to keep you healthy. So to summarize everything we say about heart CHF, making sure you follow up with your doctor like you're supposed to, follow up with a specialist like you're supposed to, weigh yourself every morning, same time every morning, record, notify your doctor's office if you're gaining 3 to 5 or more pounds, watch your salt intake, watch your sugar intake, drink fluids, but also making sure that you're supposed to be watching the kind of fluids that you're drinking, the amount of fluids that you're drinking, and just stay well. And if you have any questions or comments, you can always post it below. We'll be monitoring the post and we'll respond accordingly. Okay, so until we meet again, I thank you all for joining us today. It is cold outside, it's snowy, and if you're out there plowing the snow, cleaning the snow, make sure you're taking care and stay safe. And we will talk to you again. Thank you once again. And thank you very much, Theresa. Good night.
Thank you. Bye.
Bye.